Dealing with the patient who has rotator cuff repair, dealing with the supraspinatus muscle and the infraspinatus. These are our beginning stages. We're going to aggressively work on range of motion and stretch that capsule so we can regain that range of motion, break up scar tissue if there's any. So we're going to start off with passive range of motion. We're going to do abduction and adduction, 3 sets of 10. So we're just making sure that he can come up, and we'll stop at his end point where he feels some pain and just work from there because we're in our beginning stages. We'll do 10 of these. Here. He's complaining of any pain. We won't go up as high, but and that's your abduction right there. Then we'll do 3 sets of 10 of those. Now adduction. All we're doing is taking it across the midline of the body. See how that feels? You stand up. Just taking it up. Midline of the body. Back down. And that's it. Elbow down by his side. I want to basically make sure that elbow does not come off his hip and compensate for his range of motion. So we get that true internal and external rotation of the shoulder. So we're just going to do 3 sets of 10. The external rotation. It's all passive range of motion. And then we'll work on internal rotation, 3 sets of 10. So we're just coming in, really being aggressive, really pushing the limits and the degrees of range of motion. Alright, we're going to be working on flexion, extension, passive range of motion for the right shoulder. Still in the beginning stages of rehab. We'll have our hand on the wrist. We're going to take him to his full range of motion, as much as he can endure, and then come back down. We want to be really aggressive, so get that range of motion back quickly so nothing gets adhered down. Okay, and then we're going to be working on extension. So we're just going to make sure that his shoulder's feeling fine, and we're going to come back to extension. Come back as far as we can, and come forward. We're going to do 3 sets of 10 for both of these. Alright, we're bringing his arm up 90 degrees, and we're going to bring it across his body, so horizontal adduction. And he's going to pull in with his other arm, really feeling that stretch on that posterior capsule of the shoulder. Alright, so we're going to do stretching, active range of motion flexion for the shoulder. We're going to have the patient lay supine, and all he's going to do is actively lift his arm into flexion as much as he can, as far as he can. And we're going to do this 2 by 10, 2 sets of 10 reps. Alright, patient's going to be laying supine. We're going to have his shoulder up at 90 degrees. And we're going to have him stabilize the shoulder capsule by applying external forces in multiple directions. We're going to do 3 sets of 15 seconds. Making sure that the shoulder is being able to withstand stabilization in all directions. Make sure there's not a lot of instability or laxity in a certain direction. Or if he complains of pain, cut it. Alright, so this is going to be wall ball circumduction, working on the shoulder. We're going to have the shoulder at 90 degrees. We're going to have the elbow fully extended. And all we're going to work is full circumduction of that that shoulder. And that's active range of motion, and we're going to do 2 by 10, and those 10 are full circles, both ways. We're going to have the shoulder at 90 degrees, elbow fully extended, and all we're going to do with the ball is we're going to make it go horizontal and vertical, and then eventually it's going to make a cross. And we're going to do 2 sets of 10 reps. A full rep would be 1 cross. So 1 vertical and one vertical and 1 horizontal. Really pushing, making sure that patient's pushing his range of motion and going out as far as he can and going up and down as far as he can. So we're working on flexion and extension of isometrically, and all he's going to be doing is leaning against this ball right here, applying pressure with his body weight so he can stabilize and contract his shoulder muscles simultaneously as he's pushing in there. We're going to do 2 by 10 seconds of these. That's flexion, and then extension. We're just going to move around. We want to assist him. He's going to put it right there above his elbow. He's just going to apply his body weight in there. So he's stabilizing that shoulder capsule at the same time and contracting those muscles. Once again, 2 by 10 seconds. Alright, we're working on isometric contractions here for ab and adduction of the shoulder. What we're going to do is create an angle right here as we see, and we're going to lean into this ball right here, but we do not want his hand to come next to his body. So we're contracting and stabilizing that shoulder capsule at the same time. These will be 2 by 10 seconds. And then we're going to work on adduction, adduction. We're going to put the ball in between the arm and the torso, and we're just going to squeeze and contract that muscle isometrically while stabilizing. This will also be 2 by 10 seconds. Alright, for this one we're doing 2 by 10 seconds. We're isometrically contracting the shoulder. We're doing external rotation, and all we're doing is focusing on keeping this elbow next to the body and pushing against, leaning against that ball with his body weight to stabilize and contract those muscles in the shoulder. Alright, now we're going to move to internal rotation. We're just going to set the ball on the other side, have him clamp against that, and we're going to contract as if he were pushing internally for his internal rotation. This will be 2 by 10 seconds also. Alright, so this one will be another isometric, working on the scap and shoulder elevation together. All he's going to do is hold onto the chair, and he's just going to isometrically elevate his scap and shoulders and hold that, and we're going to do that for 2 sets by 15 reps. So just relax. Make sure we're getting that nice elevation of the shoulders and scaps.
This exercise is bent row with elastic. What we're going to do is we're going to have my man here bend over a little bit. He's going to retract his scapula, extend the shoulder, and flex the elbow. We're going to do this 3 by 10, 3 sets of 10 reps. Alright, this exercise is active range of motion, shoulder flexion, while laying supine. Okay, we're going to 3 by 10. He's just going to actively go through shoulder flexion with the elastic band while I hold it. This exercise is called D1. What we're going to do is have the elastic in the involved hand and have the palm towards the body. Then while moving through D1, we're going to move the arm across the body and the palm facing body. We're going to do this 3 by 10. This exercise is called D2. And what we're going to do is we're going to start with the thumb in the pocket. We'll move across the body. We're going to end up with a hitchhiker's thumb. So he's giving a big thumbs up. We're going to do this 3 by 10. Alright, this exercise is active range of motion, shoulder plank, circumduction with ball. So what we're going to do is get in a plank position. And he's going to place his hand on the ball. And while he's in the plank, he's going to circumduct just like that. We're going to perform this 2 by 15. Alright, this exercise is called band pull-aparts. What we're going to do is we're going to have our hands supinated, facing up. And then when we pull the band apart, we're going to look for some scapular retraction in the back. And then it's going to be performed 2 by 15. Okay, this exercise is called serratus punch. We're going to have the shoulder at 90 degrees, elbow fully extended. What we're looking for is protraction of the scapula, just like that. It's going to be performed 2 by 10 times. Alright, this exercise is called I's, Y's, and T's. First one we're going to start with is T's. Shoulders are going to be at 90 degrees with the thumbs down, palms down. And then the second one, we're going to go with Y's. Shoulders at 45 degrees, thumbs are up. Then the last one, we have I's. Shoulders are going to be at 0 degrees, and then thumbs are up. Okay, this exercise is called wall walk with elastic band. And what we're going to do is we're going to walk across the wall with our hands, making sure the elbows are locked out so the shoulders work instead of his biceps and triceps. And that's going to be done 3 by 5. Exercise is called three-way raises. We're going to start with frontal, and then we're going to move to diagonal, and then lateral. This is going to be done 2 by 15.
Three, go.
Okay, so our athlete has advanced to the advanced stage of our exercise program, so we're going to have him out in horizontal abduction with a body blade, and with this he's going to oscillate up and down with his arm and do rhythmic stabilization of his shoulder while keeping the rhythm in the body blade. Doing it out to the side is going to work the supraspinatus, and then after this one we're going to have him move into internal-external rotation, so he's going to oscillate in and out with his arm, doing rhythmic stabilization. That's going to work the infraspinatus more. We're going to do these for 3 sets of 30 seconds each. Our next exercise are going to be dips. So with this, we're going to have our athlete bend at the elbows and work more triceps and shoulders using his body weight as the resistance. We're going to do 3 sets of 10. As he progresses more, we could add weight to him. The next exercise we have him doing is active range of motion, scapular retraction and protraction. So we're going to have him sink his chest in and then pull it back up, working on moving the shoulder blades. For this, we're going to go 2 sets of 10. Alright, our next exercise is going to be bench press on a physio ball. You're going to want the physio ball to be positioned underneath their shoulder blades to help stabilize there. We're going to have them keep their chest and pelvis in line with their knees. And then we're going to have them do a bench press. We're going to press up. With this, if you're going to help, you want to follow the wrists, because if you follow the elbows and they lose the weight, it's going to come in at their face, as opposed to you stabilizing the hand and helping them through the motion. We have 3 sets of 10 on these. Next exercise is going to be push-up on the BOSU. So we're adding the unstable surface of the BOSU to help increase the difficulty of push-ups. With this, we're going to make sure that he fully extends at the top, and when he comes down, he gets to a good 90 degrees with the elbow. Our next exercise, we're going to do trampoline ball toss. We're going to do chest pass. So we're going to focus on throwing the ball to the trampoline and having the ball bounce back to our chest. For this, we're looking for a full extension of the arms. It's a quick motion. We're going to do 3 sets of 10 with these. And then we also have rotational ball toss, where we're going to rotate into the trampoline, creating a side exercise. Also with the shoulders working to throw, so you're going to work more of the rear delts. This exercise are going to be flies. We're going to have him bring the weights out to the side, and then contract his chest and shoulders to bring the weight back up above. We're going to do this for 3 sets of 10. The flies are also going to be coupled with the reverse flies. It's where we're going to pull the weights from the floor back, squeezing at the scaps and the rear delts. We're going to do that for 3 sets of 10 as well.
So this is our advanced stage exercise. We're going to do a sled push. In this case, we are using another body as the resistive force. Here we're working on stabilizing the shoulder against weight and motion.
Exercise is going to be pull-ups. So with this, we're going to have him pulling his body weight up, squeezing at the top, throw the scatters. This is also going to be working the lats, rear delts, rhomboids, pretty much everything in the shoulder. We're going to do 2 sets. Okay, so our next hour exercise is going to be tower slides. So we're going to have our patient on all fours with his weight onto his hands, and then we're going to have him go side to side with his hands. And then we're going to have him also go forward and back. The more weight that you put on their hands, the harder it's going to be. We're going to do these for 3 sets of 30 seconds each.
Alright, so this is our home exercise program. We're going to check the patient and make sure he's doing these exercises properly so we don't have any setbacks while he's at his house. We do this so we can continue our progress in rehab and not settle. So what we're going to do is work on passive range of motion for flexion of the shoulder. We're just going to bring this up, and if there's any lag in that involved arm, we're just going to compensate by pulling up with your uninvolved arm. So back down. We're going to repeat this 2 sets of 15 reps again. Now it's flexion. Now we're going to move to extension. We're going to have it where he's going to put his involved arm right here, his bad shoulder, this is left shoulder. We're going to push it back into extension. Push. There you go. And now back. 2 sets of 15. We want to make sure he's not rotating his trunk at all that much. Not compensating. Get that nice extension of the shoulder. This will be 2 sets. We're going to be working on passive range of motion again. This is our home exercise program. We're going to work on external rotation and internal rotation. All we're going to do is make sure this elbow's close to the body still. We're going to push this arm into external rotation. Get that nice shoulder, external rotation, come back in. And then he's going to pull it into internal rotation at the same time. We're going to repeat this 2 sets of 15 reps. We're really focusing on this external rotation. Make sure you're getting a nice stretch, nice range of motion, full range of motion. So this one is passive range of motion. Once again, we're doing abduction and adduction. And what we're going to do is just push this shoulder into abduction as far as we can. And then we're going to come back down. And then we're going to pull it across the midline of the body. And we're not twisting to get that adduction. This will be repeated 2 sets of 15 reps. So this is a posterior capsule stretch. We're going to bring his arm across his body, grab it with his other arm, and we're going to pull this into our body. What we're focusing on is getting that nice posterior capsule stretch of the shoulder. We're going to hold this for 2 sets of 15 seconds. And make sure we're focusing on and just focus on our breathing and getting that stretch as best as we can on that posterior capsule. So this is another home exercise program. It's called active range of motion cane balance on the hand. And this is basically working stabilization of the shoulder, flat palm, and we're going to work to try and stabilize that. So we got to move our hand with it. There we We're going to perform this 3 sets of 10 seconds as best as you can. We'll have the patient sitting down, and this is active range of motion stretching. This external rotation, all we're going to have him do is place his hand on the table. We want his shoulder to be abducted 90 degrees. We want the elbow flexed at 90 degrees. And we're just going to have him lean forward to give that nice external rotation stretch. We're going to hold this for 3 sets of 15 seconds. We're focusing on external rotation because it's the main movement for the infraspinatus muscle. This is a shoulder abduction stretch. We're going to do it 3 sets of 15 seconds. We're going to stand up next to a hard surface and push against it, isometrically contracting the shoulder muscles. Working on the supraspinatus muscle. Once again, 3 sets of 15